Hello, beautiful people. Welcome or welcome back to my YouTube video. My name is Denise. Today I'm coming back with a sit-down video for you guys. As you guys see by the title, the difference between a PACU nurse and a pre-op nurse. First of all, if you guys hear that dun 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 upstairs, if you guys hear that banging, I don't know what's going on, but I think my neighbor got some furniture stuff or whatever that they are working on, and either I or they picked the wrong day to be doing it. Yeah, just FYI. Like I said, I'm gonna talk to you guys about the differences between a PACU nurse and a pre-op nurse. My name is Denise. I am a PACU/pre-op nurse. Without further ado, let's get into the video. First of all, to get into PACU, obviously you apply. You have to be a registered nurse. You do not need to wait until a year into nursing to get into PACU. You can get into PACU literally after you graduate nursing school. Especially now with this nursing shortage, they're hiring everywhere, so you don't have to wait. If you want to work in PACU pre-op, the peri-anesthesia world, definitely apply. Make sure your resume looks really good. Anyways, I'm gonna start off first with PACU nursing. So we're just gonna ignore that sound upstairs because it's gonna go off the whole time, and I don't have another time that I'm gonna make this video, so we're just gonna ignore that. So the role and responsibility of a PACU nurse. So a PACU nurse is a post-anesthesia care unit nurse, and what we essentially do is we monitor patients after surgery. We help patients recover after surgery by doing these things. Our primary role is basically taking care of patients immediately after surgery, and helping them basically wake up from anesthesia, or just watching and monitoring them as they wake up from anesthesia. So it is considered a critical care nursing because patients are waking up from sedation, from anesthesia. They wake up, sometimes they're nauseous, they're in a lot of pain, and you have to be able to critically think and know what to do when complications arise, and you have to know what complications can arise from the different type of surgeries that the patients are having, basically. We monitor patients' vital signs like their blood pressure, oxygen, temperature, heart rate, and we do this kind of every 15 minutes until they meet the PACU discharge criteria. We also assess their level of consciousness, their airway, breathing, and respirations, like I mentioned earlier, and just make sure that they're stable as they're waking up. Another thing that we do is pain management. That is the biggest critical thing because they just had a surgery. Depending on what surgery they had, they're going to be in some type of pain. And some patients tolerate pain well than others, just like anybody. So we administer medication. In my hospital, the protocol is fentanyl, Dilaudid, and Oxy. Sometimes it could be different medications as well, but biggest thing is you're managing their pain, you're assessing their conditions, you do a full patient body assessment, and ask them about their pain, ask them about their nausea, checking their surgical sites for bleeding and complication, and making sure that everything looks within normal, or the patient is stable for discharge. Pretty much my day usually looks like this. I go to work, clock in, you set up your rooms, you get like a little report sheet from the charge nurse, and basically telling you the name of the patient, what surgery they just had, who the surgeon is, and if they're staying in the hospital or going back home. And with PACU, there's phase 1 and phase 2. Phase 1 is usually patients are staying in the hospital after surgery and they're going to be admitted. Phase 2 is they're going home after surgery as long as everything is within normal. After I get the sheet, you get yourself ready to receive the patient and report from the anesthesiologist and the surgeon. And once you receive a report, you check your patient, get their vitals every 15 minutes, temperatures usually every hour, unless their temperature is not stable. Then you do it every 15 minutes and apply warming protocols if their temperature is low. And pretty much assess your patient, get their vitals, make sure they're stable, control their pain, control their nausea. And then after that, if the patient is phase 1, you call report to whatever bed space that they're going into, whatever unit they're going into, you call report to that nurse, give report, and then you pretty much put in transport and just kind of wait it out, and transport comes, picks the patient up, and they go to the unit. So for phase 2 patients, the same thing happens. You kind of assess them, all those things I mentioned earlier, but instead of calling the nurse for report, you give the patient their discharge paperwork, and you go over it with them by educating them, and then you set up transport, get them dressed, and pretty much send them on their way. And usually with PACU, patients can stay in the PACU bed space from 30 minutes minimum to an hour on a good day. What I learned is sometimes getting a bed in the hospital it's not a quick thing. So sometimes you want patients to, like, they're ready to go within 30 minutes to go to the bed, to the unit, but there's no bed available, so you're waiting on a bed. And I've had patients stay with me for as long as like 6 hours because we're waiting on a bed. So things like that do happen, but ideally PACU patients usually stay from 30 minutes to an hour. From 30 minutes to an hour to 2 hours is how long they stay, as long as they meet the PACU discharge criteria. That is the quickest, easiest way of how a day can go, but obviously there's always like things that come up and situations that can arise, but that's just kind of the nitty-gritty of how my day or the day of a PACU nurse can go. So next we're going to talk about pre-op nursing, which is something that I just started doing a couple months ago, just to cross-train for both. And as a pre-op nurse, your role is basically preparing patients for surgery. You're usually the first point of contact that the patient sees before they head back to the operation room. Basically, what we do as pre-op nurses, we assess the patient and educate the patient. We assess their history, their medications that they took before they came to the hospital, their allergies and current health status, like if they're having pain, if they're nauseous, things like that. And then we educate the patients on what to expect before, during, and after surgery. We do not educate the patient on the type of surgery that they're having and like the risk, benefits, and all that stuff as nurses. That's not our role. But we can educate the patient on just what to expect when they're in the hospital during pre-op, during the surgery, and usually the anesthesia explains the anesthesia. The anesthesiologist explains the anesthesia, and then the surgeon explains the surgery, and they educate the patient and answer all the questions. Another thing that we do as pre-op nurses, we coordinate care. So we communicate with the anesthesiologist, the surgeon, and any other surgery team members that is in charge of that patient, and pretty much just make sure that all the pre-op testings, all the labs, all the anything that is needed to be done pre-op is done before the patient is gone to surgery. All the consents were signed, and we also administer pre-op medications. Usually patients get, and this is broad, it just depends on the hospital and what each hospital does pre-op. But for us, we usually administer Tylenol, nausea medication, pain medications, pre-op, and then they do get antibiotics, but usually we don't administer it. They do it in the OR, and just help the patient kind of relax, because a lot of patients are anxious because, you know, within reason, they're having surgery. So we just try to relieve that by chatting with the patients, kind of reassuring them that they're okay, just to help reduce the anxiety before surgery. Another thing that we do is documentation and communication. Communication is the biggest thing I'm learning in pre-op and PACU, but pre-op is very important because any little thing can stall surgery. So communication is key. Documentation is key. We document every single thing. We ask patients a lot of questions, like if they have anything that can cause them to not have the surgery, or anything that needs to be removed, any glasses or anything like that. And if patients are not supposed to eat the night before surgery, and usually we have to make sure that they follow those rules, or else their surgery is gonna get canceled. So we are in charge of doing that. We're in charge of like making sure that the consents were signed, make sure that the surgeon and the anesthesiologist sees the patients before they go off to surgery, and make sure that the patient signed the consent themselves, or if somebody else signed the consent, make sure that we have witness who noticed, or witness who also signed the consent stating that the patient did not sign the consent, if that makes sense. There's a lot that goes into it, but obviously that's just the nitty-gritty of what happens. The little rundown of pre-op nursing, like what my day kind of looks like. As a pre-op nurse, we go and get come in, set the room as well, get like all the IVs stuff out, the fluid out, set up and primed, go grab the patient, get their weight, have them use the bathroom if they need to use the bathroom, get them situated, undressed, completely clean, clip them if you need to clip them for the specific surgery, hook them up on the monitors, make sure you get their vitals every 15 minutes, ask about the medications, confirm their allergies, confirm their medical history hasn't changed, or add anything that needs to be added on there, and give them their pre-op meds, get the IV started obviously, and fluids running, have surgeon and anesthesiologists come in and make sure consents were signed correctly and accurately, and dated and timed, and then pretty much send them off to surgery when the timing is right, when everything is set, everything is good, get them off to their procedure. And pretty much with pre-op, patients are usually there depending on what surgery they're having. For first case surgeries, usually they're there for less than an hour and a half, because sometimes I work 5:30 a.m. in the morning, and first case surgeries, they usually get there at 5 a.m. or 5:15 a.m. It just depends. The first surgeries are usually at 7:15 or 6:30, depending on what surgery they're having. So it's literally, it goes really fast. And sometimes, first case, you always have two patients that you're like going between back and forth, trying to like get them situated, get everything answered, get everything signed, and then send them off. So after that first case, the day kind of usually is a little bit chilled, because you only get one patient. So with PACU, you get two patients max. With pre-op, you get two patients max your first case. They're like the first case surgery. And so usually you start with two patients, but after that, you only get one at a time. So it's really nice. So that is what I do. I right now am in love with it, and I don't know why I didn't start this sooner, but I'm grateful for the experiences and the opportunity that I was able to, experiences that I was able to get on the cardiac unit during my year there. But I love PACU and pre-op. Like, Pre-op is my better favorite right now because they both have its perks, but I love both. So yeah, so that is the rundown nitty-gritty of the difference between PACU nursing and pre-op nursing. And I hope you guys enjoy this video. I hope you got something from it. I hope you learned what a day in the life of a PACU slash pre-op nurse kind of look like. If you're trying to make a decision, if you want to start working in the PACU, but you don't know like PACU or pre-op, but you don't know like what do they do. I hope this video kind of gave you that idea. And if anything else, literally just go and shadow like shadow a PACU or pre-op nurse. Like that's what I did before I started. I shadowed, and it was only for a few hours, and that was enough for me to be like, yes, this is it. So you don't need to be there long. You can literally just shadow for a few hours, but it will help if you shadow for longer than, let's say, 3 hours, just to see if you're really unsure and you really want to see like what do they do. So definitely shadow. But otherwise, for me, I love it. There's a lot of diversity where I work right now because there's like a lot of older people in general and younger people as well. And I love that because it's not just like one group of people. It is like a mixture of people, and you kind of get a lot of experience and knowledge from that because there's nurses who have been working in PACU pre-op or just been nurses for over 30 years that I'm working with right now. And I love that because they teach you so much. And I know a lot of people think PACU is just chill. Like some days it does feel like it, but it is so critical. It is so critical that like it took me a while. Like there's so much learning to like learn. It was a huge learning curve. After you get through the curve, you kind of like settle a little bit, but I'm still learning a lot. It's definitely critical care, and crap can go down, so just, you know, be ready for that. But we're nurses, we can handle anything. With that being said, thank you guys so much for watching my video, and I hope you come back for more and check out my other videos that I've posted in the past. And yeah, I don't think I have anything else to add. I hope you guys enjoyed this video, and I will talk to you guys on my next video. Comment down below if you're already a PACU pre-op nurse. What do you like about it? And if you're thinking about it, stop thinking, just go apply and get that job. Bye.